In New South Wales, Labor has announced a plan it says will ease the strain on emergency departments. The state opposition wants nurses to treat patients with minor ailments in free walk-in clinics. Well, the Australian Medical Association is critical of the move, but some GPs are warning something needs to be done to move care into the community.
No parent likes waiting for hours in emergency with a sick child. Labor says in some cases they shouldn't have to.
What we seek to do here is take pressure off our emergency departments.
Under a $40 million proposal, 45 highly skilled nurses would work across 4 new clinics, 2 in Western Sydney, 1 on the New South Wales Central Coast, another in the Illawarra region. They'd treat colds, cuts and minor injuries. A similar system has been operating in the ACT for the past 5 years.
The community will tell you whether you got it right, and almost 100,000 people can't be wrong.
The Australian Medical Association has slammed the proposal.
We already have well-utilised, well-structured general practice in the community, and this is what should be supported, not devalued.
Labor's latest thought bubble is already unravelling. The AMA, I would have thought, is a reasonable stakeholder in the health system.
While emergency departments have seen an increase in the most urgent types of cases over the past few years, there's also been a drop in the least urgent attendances, the same types of patients nurse-led clinics would see. But some doctors are warning that trend could be reversed with the introduction of the federal government's planned GP co-payment by pushing people who can't afford it into hospitals.
So the state government needs to be bold. It needs to be starting more care in the community. And if the federal government's not going to do it, and if the AMA is not going to do it, I think it's great that the state government starts.
If there was some sort of clinic like that, it'd be great.
I just had major gastric surgery, so having nurses around and even going to a walk-in clinic would be very helpful.
Absolutely, I would use it.
A healthy reception from some voters at least. Claire Ed, ABC News, Sydney.